Hello my dear colleagues, and this is an interlude in the ECG course, as we are going to take a break in order to prepare much more lectures and in order that I need to finish other tasks in my practice, and then we are going to resume our ECG course today. So we are going to take a short break. Let's summarize what did we discuss so far in the ECG course. We discussed basics of ECG. We discussed how to interpret an ECG in a systematic way. We discussed ECG axis regarding the P-wave axis and the QRS axis. We discussed the Chamberlain rules in order to decide that the ECG is normal, and we discussed ECG terminology, some of the famous ECG terminologies. We also discussed atrial enlargement and how to diagnose it regarding left and right atrial enlargement. We discussed ventricular enlargement and how to diagnose LVH and RVH. We explained how to diagnose left bundle and right bundle branch block, how to diagnose fascicular blocks including the bifascicular and trifascicular, and different types of ectopics in ECG. We also discussed the classification of radioarrhythmia including sinus node dysfunction, AV blocks, and the peculiar isorhythmic Av dissociation. We also explained the classification of tachyarrhythmias. We explained SVT, and we explained ST depression and other ECG features that associate SVT and their clinical significance. We discussed atrial flutter, atrial fibrillation, how to diagnose each one of them and how to differentiate between them, and the famous Ashman phenomena. And also we explained approach to wide complex tachycardia and how to differentiate between VT and SVT with apparency, ventricular tachycardia and its different types, torsade de points and how to spot diagnose it in ECG, irregular wide complex tachycardia and how to differentiate its types, and of course the famous and peculiar accelerated idioventricular rhythm. What we are going to discuss after this interlude, we are going to discuss ischemic heart disease and the different ECG features in ischemic heart disease in detail, because it is one of the most important topics in the ECG course. ECG in different structural heart disease like heart failure, pulmonary hypertension, pulmonary embolism, pericarditis, and each one of them would have a specific dedicated lecture. ECG in systemic diseases like electrolyte disorders, digoxin toxicity, cerebrovascular accidents, and hypothermia. Famous ECG syndromes like Wolff-Parkinson-White, like long QT syndrome, short QT syndrome, like Brugada syndrome, and each one of them has a dedicated lecture. ECG maneuvers like the Lewis leads, the posterior leads, and the right ECG leads, treadmill test and how to interpret it, Holter ECG, and of course we will have a lecture for pacemaker ECG and how to interpret it. Thank you very much for all your interaction since the start of the course and all your positive reviews and all of opinions that helped me to improve my lectures, and wait for much more interesting lectures after this interlude. Thank you.